Don't mind me just getting my protein while I wait for some people to sign on. Then we'll have a discussion. That's so cute. Random. I was wondering how these curls were gonna look on camera from when we started shooting Papoose Got again. But I'm feeling it. I'm feeling it. Also apparently feeling myself because as y'all can see, I just kinda did not care today because I've been at home chilling all day. So, you know. Well, I can finish this later. Let's get some notes. Alright, welcome back to Prudish Pillow Talk Live. I am Amanda. I forgot to put on a bra. Ooh, that's okay. My name is Amanda Nicholson. I am a licensed associate marriage and family therapist that specializes in sex therapy. More importantly, my focus is on helping women advance their communication around their sexual wants and needs in and outside of the bedroom. So, building their intimacy and being able to openly express what they need from their partner. So today we are going to talk about mental health disorders and relationships. If you see me looking up and down, it's because I'm on live on both Instagram and YouTube. Okay, so in case you don't know what a mental health disorder is, a mental health disorder is something that can affect both your mood and your behavior. So that could be mood swings, hallucinations, that could be erratic behavior. So like, what's something erratic? Like I'm going on shopping sprees excessively. Like we all sometimes go on shopping sprees, but like say if you get upset and you always go shopping and you rack up a bunch of debt because you're, upset. Excuse me, that turkey. All right. So these different things, when you have those changes in your mood and you have those changes in your behavior, they can also affect your relationship. And a lot of people, they love to call their partners bipolar. They love to call their partners, what's the other one? Is bipolar? I can't think right now. I've been off work so long. But dang, what is it? Bipolar? They love to call their partners bipolar, schizophrenic, and borderline. Those are the main, disorders people like to label people. People who don't have degrees like to label people. But in reality, we shouldn't just slap those labels on, to people because those are real things that people are actually dealing with. So the thing is, if you're somebody who's actually dealing with a mental disorder and you're looking to date or you are currently in a relationship, that's definitely a conversation that you and your partner have to have around that topic. Reason being is because different mental disorders, require a different level of care and management, whether it pertains to going to appointments, medication or going to appointments and medication depending on a person's diagnoses. Those are things, that come with somebody's package, if they have a mental disorder. So I know a lot of people are probably like, okay, well, how do I even have that conversation? Is that a first date conversation? I would say probably not, mainly because, people hear, mental disorder, you tell somebody like, oh, I suffer from depression or I'm bipolar, they automatically think, oh, you sad all the time, or oh, you crazy, you gonna go crazy on me. But that's not the case. Most people who have mental disorders know how to manage them pretty well if they have a good team around them and a good support system. But at some point, say if you really do like somebody, and it gets to a point where they could possibly be around you when you had, let's say, an episode of some sort, or a down day, as we also like to put it in the biz, um, they need to know what's going on. So it can be a really uncomfortable situation disclosing to somebody that you have a mental disorder, mainly because of the point that I just made. When people hear that you have a mental illness or a mental disorder, they automatically assume that you are crazy and something is wrong with you. But the reality is that you are not your diagnosis, so always remember that your diagnosis is just something that is a part of you, but it doesn't make you who you are. So once you get over that, fear of disclosing to somebody that you have a mental disorder, or once you get comfortable enough with them to feel like you can disclose with them, I would suggest that you practice with a friend that knows about your mental disorder, or a family member. Just let them know, like, okay, I'm ready to tell this person about this, but I want to practice the conversation. Like, what should I say and how should I go about it? Because it takes a very big level of vulnerability to tell somebody, about any health issues that we have, whether that's, something big or something small. So while it may be a difficult discussion, it's a discussion that has to happen, especially before you get too serious. And you have to be able to articulate to your partner what it is about your mental health disorder that you would want them to know, just so they could be more understanding towards what it is that you have to deal with on a day-to-day basis. Because as we know, managing our mental health is a day-to-day thing. And for those, hey girl, and for those of us who have mental health disorders, it's something that we have to manage on a day-to-day basis. We have to make sure that we manage our mood. We have to make sure that we manage our behavior. And that could be with or without medication, that we have to manage those things. And the people who we are romantically involved with, they need to know about, okay, what does that management look like? Which is why you have to have those conversations. So you have to let your partner know that your needs in your relationship may be very different than the needs that somebody else they were in a relationship with previously may have had. So for instance, self-disclosure, I think I've said this before, like I have PMDD, so that's premenstrual diasporic something disorder. So basically, I experienced PMS for a longer time than the average woman. So like 2 weeks out from when somebody else would actually experience PMS, I experience it. So that means my mood changes dramatically. Like I'm probably like leveled off for like a week, but then after that, my mood may change dramatically, and I might get sometimes I can get a little violent. I'm not very proud to say that, but this is something that me and my partner have discussed from the time that I was diagnosed with it. We talked about it. We talked about what that looked like and all those different things. And it's important because, like, say if you suffer from depression or bipolar disorder, like you experience mood swings. And people with borderline personality disorder, they can get very passionate about certain situations. And if you are in a relationship with somebody who has never been in a relationship with somebody with a mental health disorder, you have to talk to them about what it looks like when you have an episode, what it looks like when you are here versus here. That has to be a discussion so that they can know how to best handle it for themselves. And I don't want to say handle you, but so they could know, so they could be more knowledgeable about you as a person in those instances. And you also have to be patient with your partner, mainly because a lot of people, they don't, talk about mental health. And a lot of people, they aren't in relationships with people with mental health disorders. So you have to be patient with your partner as they learn you. They learn about your mental health disorder so that they can, help you whenever you need help, and so that they can better understand when you do have like certain episodes or sporadic mood swings or anything like that, or hallucinations, because some people, they have schizophrenia and they live very normal lives. Like I said before, people automatically assume that mental health disorder equals crazy house, but it doesn't. People function on a very high rate with mental health disorders to the point that they lead very productive and successful lives. But in order to do that, the support system around them has to be A1. And that comes with talking to people about what's going on with you. And like I said, you shouldn't be ashamed about your mental health disorder. I know there's a stigma out there about mental health disorders, but when in a romantic relationship, that's definitely something that you want to talk to your partner about. You also need to be willing to educate your partner about your mental health disorder. Like I said, we don't talk about mental health enough. So a lot of people, they have these stigmas and assumptions about what certain mental health disorders look like. Like if you told somebody, oh yeah, I suffer from depression, they automatically assume that you're sad all the time, but that's not what depression looks like. There are many people that suffer from depression and are very high functioning, and you would never know that they were depressed. So a part of educating your partner is also breaking that stigma around mental health disorders so that they can have a better understanding of what that looks like. Because if sometimes you tell people stuff like, oh yeah, I suffer from depression, or I take antidepressants, and they're kind of like, for what? You don't look depressed. But it's like, what does depression look like? Or what does schizophrenia look like? What does being bipolar look like? What does PTSD look like? None of these mental health disorders have like a face. So with you educating your partner on these things helps them to not just better understand you, but to also be able to break those stigmas with their own friends and families around, the topic. And another reason, like I was saying, to be patient with your partner is also because they are not mind readers. So if you're having a mood or an episode, let them know, so that they, won't do something to further upset you. If they are knowledgeable about, what's going on with you, it'll be easier for them to help you if you do or want help in that situation. So let's flip it to supporting a partner who has a mental health disorder. So when supporting your partner, also remember that they are the expert in their own experience, especially if they are like in their 20s or 30s, and they have vocalized to you that they've been to a therapist or they're on medication. So this isn't one of those instances where you're like, oh, you don't need medication, you should do this and you should do that, blah, 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 blah. Let them educate you and let them be the expert on their own experience. Also, and I say that because unless you've actively been in the therapy room with your partner and the therapist has given you suggestions on what to do with your partner when they are feeling a certain way, just try to refrain from being their therapist in a sense, and try to just be their partner and be supportive in that, in that way. And also, educate yourself, so Google is our friend. And if you find things on the internet, ask your partner about it, just let them know, I'm trying to find out a little bit more about your diagnosis and what I can do to support you. And I found this information. Can you let me know if this is correct, or how does this apply to you and how does it not? Just to have a conversation around that. And the most important part as a partner, as always, when your partner is talking to you about any of their situations, is for you to just listen and validate their experience, because the more you listen, the more helpful you will be, and the more helpful to you, it will be as well. And the last suggestion that I have for partners is to always give your partner the room that they need when they are experiencing something like an episode. So for instance, a lot of people have experienced trauma, sexual trauma, and they do end up in relationships. And people who experience any type of trauma usually suffer from PTSD, which is accompanied by symptoms of depression and anxiety and all those different things. And sometimes they are also coupled with other mental health disorders like bipolar disorder. So it's important for you to ask your partner, like, how can I support you if you're having an episode? How can I support you if you are experiencing a hallucination, if they have schizophrenia? How can I support you if you're having one of those down days? Because on those days, while the best support that you could give them as a partner may be to give them space if needed. But of course, if your partner has a history of self-harm or different things like that, you'll handle that much, much, much differently, because you'll know what they need. And another helpful thing as a partner is, helping your partner keep track of their moods. Because as somebody who has like a mood disorder, basically, keeping track of your mood is very important for your doctor and your therapist to know about, just so they can see how you're progressing, how your medication works. And if you and your partner are super, super, super close, that's something that you all could do together. And that could be, super helpful for them as well. But I'm going to wrap this up. And I want to thank those of you who tuned in on YouTube and on Instagram. But those are just some helpful tips to think about. Managing your mental health in a relationship can be very difficult, especially if you do have a mental disorder, mainly because, nobody really can relate to you sometimes when you're going through those things. And the next best thing is your partner, besides your therapist and your PCP, is your partner. So it's very important for your partner to have some sort of understanding about what it is you're going through, so that they can help you the best way that they can in being supportive. And for those of us who have mental disorders, we just, some days we have to roll with the punches. And, if you have a partner who can support you during those things, you are very lucky. Hold on to them, especially if they exhibit understanding of what you're going through and those different things of that sort. So if you have any more questions on this topic, let me know. Let me check really quick to see if there are any questions here. Nope, no questions there. And all right, that is it for this episode of Prudish Pillow Talk. I will see you all next week, where I will be giving you tips and tricks on mindfulness that you can do anywhere in the world, at work, in the grocery store. Just really quick things as we end Mental Health Awareness Month. So thank you again for tuning in and your continued support. This will be available on Instagram for 24 hours, and it will be available on YouTube forever. So see you next time. Bye.